Doesn't it feel like everything is digital these days? I mean, from virtual classrooms to QR codes for menus or proof of vaccination. But how do you feel about your health records being stored digitally, like on your phone, for example? Our next guest is going to tell us all about this growing trend of digital healthcare. Tech consultant Mohit Rajhans joins us this morning. Nice to see you again.
Nice to see you as well, Lindsey.
Okay, so let's look at this from all sides. Let's start with the benefits. Why is it a good idea to save health information digitally?
Well, I think we're starting to see a massive digital acceleration starting to happen as a result of pandemic life. And everything from QR codes to, like you said, some health card information is starting to be stored on our phones. But we're also in a situation where, Lindsey, I'm sure you remember, the doctor's office usually faxes the information to somebody else, or an appointment might get mailed by a referral might get
Yeah.
mailed. And so now we have to move beyond that. We're in a perfect place right now where we need to start to have more accountability for our records, and we have the ability to do that because the paperless trend is starting to be incorporated by many health professionals. We notice that e-health is growing. In a very near future, we will likely see some form of a record kept on our health cards. And this is the other part that I find really interesting, Lindsey, is that my parents' doctors, for example, right now are about to retire, and they have a wonderful rapport and relationship with them. But the point is, they won't have that with a new doctor. So to get access to global resources with that information will be important for the elderly population as well. So we need to consider that when we're considering our health records.
And I have to tell you, being able to connect with my doctor over email, because I can't do that with our pediatrician, it is a game changer. It is so fast and convenient, at least for us that are looking for that information.
So let me ask you very quickly,
yeah,
as a parent, are you
yeah,
comfortable with e-health services right now? Because that's more likely what
yeah.
your family will be. Okay, you are. That's great.
I am
That-
personally, but I mean, we talk about privacy. I mean, that's one of the things that we have to discuss as well about
yeah.
the privacy factor. I mean, recently we heard that, the mandatory Olympic app in China for athletes, that made headlines for having security flaws. So how do we know when data is being saved in a confidential way?
Well, I think when we look at the Olympic situation in particular, we have to remember that different countries have different rules. So what we consider as tracking on certain devices isn't considered what other countries don't have the same rules. But the difference with the security with reference to our health information is that when we look at records like you can keep on My Health app, or you can keep on the health record app on your phone. In many cases, those are double factor authentication that are only personal to you and who you share it with. When you go out and you're talking about the Olympics and mass use type apps, those you're volunteering information, setting your own settings for. So what I think you have to turn to is when you are creating a folder or any app with secure information about your health records, do it on an app that's secure from either an app store or an Android store. Don't assume that you can just scan your documents and keep it in one place. The other aspect, Lindsey, we have to remember about this with reference to these China security thing is it for the competitive advantage or is it for the health records? Because both can be at play. And I think that's the research that I'd like to see a little bit more information about.
And I want to go back to something you were just talking about. So from a personal standpoint, where do we get started in terms of like the tools that we could, if somebody's watching right now, they're like, okay, well, where do I go? Like, how do I store my own information? What do you suggest?
Yes. So there's several apps for both, I go mobile first. So on your computer and apps, the three things that I always tell people. There is a My Health app that exists. And it's interesting, right? Because we're connected by gadgets and wearables and stuff like that. And we're not in a situation yet where we've connected them all together. So now we can consolidate them in one of these two types of apps, be it Android or Apple users. But the good thing about it, Lindsey, is that just from a practical standpoint, by scanning, emailing yourself, and storing things in some form of iCloud storage or cloud storage, you're already giving yourself that security that we didn't even have 5 years ago. There are so many family records that we have of our family expanding and the records that are happening within their health that we need to keep and be aware of. Now, I wanted to get to this board very quickly about trackers on apps. I think one of the biggest issues that people feel right now is that what are we signing up for and what are we giving information for and how can it be used against us? I think we have to go back to this place, Lindsey, where we go to our settings and we quite simply start to decide what it is that we want to share with people. Because at the end of the day, a health practitioner is going to be able to get that information from us that we're giving and be able to make a way better assessment than having to go through layers of information in front of us. And so we know that we're looking towards efficiencies in health, and we're looking at keeping these records so that we can become more efficient at our health, which is very important.
Absolutely. Great tips and great information, Mohit. As always, nice to see you. Thanks.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.